Hey guys, Dr. Nora Shilo here. I'm back with another video for you, and this time I've got Penelope with me in the background. Today I just wanted to discuss the different supplements that I recommend in pregnancy. This is another question that I get pretty frequently, so I just thought I'd put a video out there. This is just something that I've noticed through my own clinical practice to be really effective, and also as a new mom, as someone who's recently been pregnant, I found these things to be really helpful and really effective for in certain cases. So first and foremost, I definitely recommend a prenatal. Like I said, the diet is really difficult to count on. So if you have a really healthy diet, if you don't have any dietary restrictions, like you're vegetarian or you're vegan or anything, chances are you are getting a lot of nutrients through your diet. But there's a lot of research coming out these days saying that a lot of our foods are nutrient deficient because our soil is nutrient deficient. So it's really hard to know and it's really hard to measure that. So I definitely recommend taking a prenatal just so that you know that you're covered. So in my previous video, I mentioned which prenatal I recommend and the reasons why. So that's NFH Prenatal SAP, it's called. Now, a few other things that I recommend on top of that is the first one would be a prenatal DHA supplement. There's a particular brand that I recommend. The reason that I recommend DHA is because it's, what is DHA? DHA is a specific fatty acid that's important for the development of the baby's brain. So it is found in omega-3 fatty acids, and it's something that you would find in like a fish oil supplement. In my opinion, you should be getting a really good quality fish oil. It's something that can go rancid quite quickly, and you definitely want to get one that's kept in the fridge. So if you're at a drugstore and they have like those fish oil capsules that they just keep at room temperature, I don't really trust those, to be honest. I would go to like a Whole Foods or a health food store that has a more professional brand that's kept in the fridge. So you want to go for the higher DHA, not the EPA, during pregnancy specifically. Now, the next thing that I often recommend is probiotics. So I often recommend probiotics for two reasons. One is for the digestion. So we know that women's digestion can be compromised during pregnancy, particularly a little bit more backed up. And the second reason is for the immune system. So the immune system is compromised during pregnancy. So to support that, I generally recommend just a low dose probiotic, nothing crazy, like a very introductory dose of 10 billion. And for that one, I recommend NFH as well. They actually do have good research in babies for preventing eczema. So prenatal, fish oil, so DHA, fish oil, and probiotics. Magnesium is one that I recommend sort of not all the time, but pretty frequently. Just a low dose, again, 200 to 400 milligrams. The reason I recommend this is for sleep as well as for constipation. So it can help with both of those things if you just take it before bed. Now, there are different types of magnesium supplements, and you want to take a magnesium glycinate. That's what you want to look for. Very important to get enough vitamin D. Vitamin D is one that you are going to continue to give the baby once the baby's born. I usually actually recommend 2,000 IUs a day, and my recommendation is to get it in a liquid form. So that way, because it's fat soluble, it'll be emulsified in fat, which makes it easier for your body to absorb it. What else? So that was prenatal, right? Fish oil, probiotics, magnesium, vitamin D. Magnesium is kind of like, if you have problems with sleep and constipation, if your digestion is normal and your sleep is good, then I don't see a need to take magnesium. I think that's everything. I don't like to load up my patients when they're pregnant because, you're already pregnant, you're already sensitive to smells and things, and I'd rather you get those nutrients through the diet. So I don't recommend a whole lot of things. It's just that, something like fish oil is hard to get through the diet unless you're eating fish all the time. Probiotics, hard to get through the diet, same thing. Vitamin D. So those are kind of like the basic necessary supplements that I recommend on top of your prenatal or your folate. So if you have any questions, just shoot me an email and I would be happy to answer your questions, and I will see you next time. Thank you.